Hello there. In this video I'm going to talk about all things hip flexion and how you can strengthen your hip flexor muscles. Now there are four of these muscles. We've got the deep hip flexors to start with. Probably the most commonly heard of is the psoas major, which originates from the lumbar spine, as well as having an attachment onto the intervertebral discs and actually onto the diaphragm too via something called the arcuate ligament. This muscle goes through the deep abdominal cavity and merges with a muscle called the iliacus, which starts on the inside of the pelvis, and then they both conjoin into a common point of insertion onto the lesser trochanter of the femur. The superficial hip flexor muscles, we've got the rectus femoris, which is one of the quadriceps. It's the only quadricep which crosses the hip joint, starts on the AIIS and then merges with the other quadriceps into the tibial plateau and through the patellar tendon. The last muscle of the hip flexor grouping is the longest muscle in the body, the sartorius, which starts from the iliac crest, wraps diagonally over the thigh and then inserts into a place called the pes anserinus on the inside of the knee. Now collectively these muscles promote the action of hip flexion. Now in practical terms that means the thigh is brought up and forwards, and this is in opposition to the thigh moving backwards, which is called hip extension. But the hip flexion is a very important movement, very functional movement, super important when it comes to running, driving through, hiking, walking, whatever it might be. So it's a very natural movement for us to do, but these muscles can become slightly changed in their length-tension relationship with other structures in this area, the hip extensor complex. Perhaps that's because we spend a lot of time sitting down these days, and if you hold a posture for a long enough time, there's maladaptive processes which begin to happen, and there's confusion amongst how these muscles should operate. You also hear a lot of the time people saying hip flexors have got to be stretched, got to be stretched, got to be stretched. Yes, there is a time and a place for that, but whenever something's tight, you have to try and ascertain why it's tight. Now it might be because you're held in a long position, as I just mentioned, there's postural problems which come in with extended periods of seating, etc. But also the hip flexors can become quite weak, and in the case of the psoas major, that's a prime spinal stabilizer as well. So you've got to be a little bit careful just going in and trying to stretch these things. And detailed assessment and objective analysis is important when you're working out what's actually going on with this feeling of hip flexor dysfunction. However, strengthening them is really important and it's often a neglected part of training protocols. So there's lots of different ways to approach this, and as per usual I'd recommend that you think of optimal loading when it comes to starting off a new type of exercise. This web Pilates techniques can be quite helpful. We've got the modified matwork scissors, and if I just demonstrate that quickly, it starts off from a rest position, and it's one of the most simple movements you can do where you maintain a neutral lumbar-pelvic alignment and then draw the leg up into tabletop before placing it down and then doing exactly the same on the other side. Now this exercise is a level 1 beginner exercise, and it's ideal for people who suffer from chronic low back pain or who are recovering from surgery. It's got a limited reach in terms of what it can do, but it is generating that same hip flexion movement, and because it's encouraging the participant to maintain a neutral lumbar pelvic position, it's a really, really good start point from which to begin this hip flexor strengthening journey. The way to modify that would be to simply add an ankle weight if you just wanted to stick to that very simple principle of bringing one leg up at a time, and that's a very valid progression. And because you need to try and permanently push on in terms of what you're trying to achieve with muscle strengthening, you have to think a little bit more broadly. If we take that modified level 1 of the scissors from the Matwork Pilates program, it's quite a limited range of movement that's happening. It's not reflective of what's happening, say, when we're running, when the hip starts off in an extended position and may very well come through into a fully flexed position or nearly there. And so beginning to increase the range of movement, providing your body allows you to, is very important. So if we kind of adapt that, we can, if we're able to progress, we can simply straighten the leg into a modified scissor. So you could come from essentially floor height and then come through. And you can see now I'm getting much more range of movement than starting from that rest position. If I want to take that further, I can just come to the end of my little plinth, or you can come to the end of a bed or a table or something, and then that leg can drop below horizontal, and that's said to be in an extended position behind neutral. And from there, you can go into a generous range of movement with your hip flexion. And again, you can add on ankle weights as an easy progression. What you need to watch out for here is as you go into neutral and then past neutral, it's very quick for the lumbar spine and the pelvis to rotate and get dragged into a non-neutral position with the action of that leg. Now, it's not to say that you shouldn't ever go into lumbar spine extension as your leg goes behind you. That's a very natural combination, a natural kind of functional movement. However, when it comes to isolating and making sure that you're doing this exercise correctly, I would encourage you to try and keep the lumbar spine neutral. Just because a lot of people will suffer from a lack of core strength around here, a tendency for the back to compress, tightness, shortness, compression in this area. And if you're then accentuating that with a lordosis, an arching in the back, with a hip flexion movement going below horizontal like I've just demonstrated, it can sometimes create problems that you don't want to bring in, particularly when you start upping the weight a little bit. Now, the other thing which we want to do is move away from a supine position, which is a very good starting place with the modified level 1 and then moving on to those variants I just showed you. But quite quickly we want to try and get this package working in a functional standing position. So there's very simple elements here. The standing scissors from Pilates is a perfectly good exercise as well. We're coming up into a tabletop position and then coming back down. And just as we do on the supine variation, as you come up, you don't want to collapse your body. Because these hip flexors, when they shorten, attach to the thigh, and indeed to the tibia, south of the hip joint, and they all attach to the lumbar pelvic region. If you let them, they're going to collapse both ends. They're going to bring both ends together. So by keeping the neutral lumbar pelvic alignment, when you bring it up, not only are you kind of guaranteeing that you're getting true hip flexion and not a false movement with collapse of the torso, but you're simultaneously strengthening the core muscles which resist those powerful hip flexors. So getting used to doing that movement in standing, either for repetitions on one side, and going up and down, just dissociating the movement of the hip flexion from the core stability, or simple marching on the spot. These are, again, all very valid versions of the hip flexion, the scissors repertoire. Where we want to go on to, though, is to get some instructive weight into this standing functional movement. So again, if you're beginning this journey of strengthening hip flexors, start off with a small weight. You can just put a simple ankle weight, a couple of pounds or something, and get used to doing multiple repetitions of that, perhaps practicing for 30 to 60 seconds standing with that simple hip flexion movement repeated, making sure that as you go through and increase the repetitions and the weight, that your back doesn't feel compromised and that you're able to maintain not just a neutral position in your core, but also a quality of movement. So you should always kind of imagine you're being able to move through something thick and viscous like honey or treacle or something, so that you're not having to really spring up and generate excessive momentum to try and make up for any deficits in strength. Now, where we're moving on to, I think the final part of this brings in my trusty kettlebell. This one is 16 kilos, so that's just over 35 pounds. That's probably about 20% of my body weight, which I suppose I've built up to doing and feels to me like a pretty good level. I think when you move on to something like a kettlebell, which has extra uses, which I'll go through in a moment, starting off at about 10% of your body weight is probably where you want to begin. And something in the order of 10 repetitions I found to be helpful both for me and for clients I've worked with. Now, I think the advantage of the kettlebell is you can simultaneously strengthen other aspects which are important in that drive phase. We're thinking predominantly about the ankle dorsiflexors. You do need to do this one from a step to get clearance for your kettlebell, and you need to be able to hold on to something on the opposite side. Now, the reason it's important here is that you can fit your foot through, and then the act of lifting up gets those ankle dorsiflexors. Now, these are the muscles which promote ankle dorsiflexion. And although it's going to be a real heave for me to try and do it with a kettlebell on, I can hold my ankle in a neutral alignment, and I'm working my ankle dorsiflexors in an isometric fashion. That means they're working, they're contracting to stop the kettlebell pulling my foot down and it falling off. So these muscles are simultaneously important when it comes to foot clearance and making sure there's no falling, and it's a nice muscle group to exercise. So you can kind of kill two birds with one stone with this variation. Now when you're adding in this weight, it's going to be much more difficult to try and maintain your neutral position. So this is where breath work can be extra important. Take a breath in, and as you breathe out, draw up, and at the top of the movement there shouldn't be any collapse in your center. With the weight, you need to make sure that when you're coming up and down, it's not dragging you into a speedy rep. You're in control of the whole pathway of that hip flexor motion, and just make sure that you feel safe with whatever weight that you're using. As I said, anything more than that starts getting a bit punchy. Certainly in my experience, 20% of body weight is probably as much as you'd ever need to go. I suppose the other option, if you don't have kettlebells handy and you want a little bit more bang for bullets, is resistance bands. And this is a question of adapting it to whatever technique suits you. You can either tie it around your foot and then have it anchored underneath the other one. You can have it fixed to something very solid on the floor. The only issue with resistance bands, as everyone well knows, is that the more you move into resistance, the more the relative weight increases. So with hip flexion, it starts off relatively easy, but the more you get up, the more the weight increases. And so that may affect how much you're able to do in terms of that arc of movement. And therefore you might find that this is a little bit limiting. You perhaps also don't get that consistency through range, which I think is important, and it's probably why I prefer using kettlebells. Now, when you're doing these exercises, I think the final thing I'd say is something I've touched on a few times already. It's very important that you don't feel any discomfort in your low back when you're doing these drills. We've got to try and generate a pure hip flexion movement and not have any deviation into the midline or perhaps out. That's a little less common, but making sure you're not coming up in an aberrant pattern. It's thinking about what you're trying to replicate when you're moving, particularly running or climbing up a hill or something like that. And gradually, if your body is happy with this over the course of several weeks of practicing, you can generate a little bit more pace on the way up, but the more you increase the pace and the intensity, the more tendency there is for the collapse up top. So this is why we always emphasize maintaining your core control while you're shifting whatever weight you're doing, regardless of what position you're in. And that's why that lumbar pelvic neutral and maintaining it throughout, I think, is a really important aspect of your hip flexor training. Anyway, these techniques I find really helpful both for me and my clients, so hopefully they're helpful for you as well. Thanks for listening.